Upon entering a scene, the responder sees that there is an unconscious patient lying on the ground. The responder's first step is to make sure that the scene is safe, there are no dangers in the surroundings. The responder will then put her gloves on and check to see if the patient is unconscious. After finding that the patient is unconscious, the responder will then need to activate EMS. After EMS is contacted and seeing that an AED is not available, the responder will then check the patient's vitals by using the look, listen, and feel technique for no longer than 10 seconds. Finding that the patient does not have a pulse and is not breathing, the responder will immediately begin CPR. Placing the patient in a supine position and uncovering the chest, the responder will kneel close to the patient's side, with her knees as wide as her shoulders. By using the correct hand position, the responder can find the compression site by placing the heel of one hand on the center of the patient's bare chest between the nipples, about 2 finger widths above the distal portion of the sternum. The responder will then move her shoulders over the patient's chest to apply force in the right direction and begin the first set of 30 compressions. The compressions should be 2 inches deep at a rate of 100 beats per minute. After the compressions, the responder will place the mask over the patient's mouth and nose. By using the diamond technique, the responder will open the airway and apply 2 breaths, each lasting for no longer than 1 second, remembering to inhale between breaths. Continue for 1 minute and reassess the patient's vitals. If there is no pulse, continue CPR until EMS or an AED arrives and reassess every 2 minutes. If there are 2 responders, the steps leading up to the chest compressions are exactly the same. Before beginning the compressions, the other responder will be at the head of the patient. One responder will provide chest compressions while the other provides ventilations. After 30 compressions, the other responder will deliver ventilations. The compression rescuer can call for a switch at the beginning of a cycle.
Switch 2, 3, 4.
After repeating the cycle for 2 minutes, the responder should reassess and continue if EMTs have not arrived.
17, 18, 19, 20, 24, 25, 26, 27, 28, 29, 30.
After the last compression, the rescuers will switch positions simultaneously and continue the cycle once the responders are in position. Upon seeing that there is an unconscious adult patient, the responder will check the scene for safety, activate EMS, and put on her gloves. The responder will then open the airway using the head tilt chin lift or jaw thrust technique. The head tilt chin lift technique is shown here. Use the jaw thrust technique when a spine injury is possible. After inspecting the airway, the responder will deliver 1 breath every 5 seconds for an adult, and every 3 for an infant. The responder will glove up and place gauze on the wound, telling the patient to elevate the wound. If the wound continues bleeding, apply more gauze and re-elevate. Then the responder will place steri strips across the wound, close together and tight enough to make the skin wrinkle. The responder can then use a gauze roll and begin to wrap from distal to proximal portions of the radius, tying off the wrap over the wound to apply constant pressure at the laceration, shown here. Seeing that a patient has a fracture on one of her upper extremities, the responder will splint the arm using a triangle bandage. The responder will begin with the bottom of the bandage on the patient's elbow and tie a knot to prevent the elbow from slipping out of the bandage. Then she will use the ends of the bandage to tie them together behind the neck, making sure the hand is above the heart. Using a second bandage, the responder will secure the arm in place. The responder can also use a board to splint the upper extremity. The responder can place the board, making sure the fingers are free for a cap refill. Then the responder will wrap an ACE bandage around, securing the board in place. Using a second bandage, the responder will secure the arm in place, with the hand being above the heart. If a vacuum splint is available, the responder will begin by placing the splint under the arm, while the other responder lifts the arm on the count of 3. After adjusting the splint, the responder will strap the splint into place and begin manually vacuuming. After vacuuming, the responder will readjust the straps while the second responder removes her hands. The extremity is now splinted.